I'm a London boy. I was born and bred in London. I've been a police officer for 45 years now. I did 36 years in New Scotland Yard, working my way up through all the ranks. And after 36 years, was able to retire from the London Police, but take an opportunity here in the Royal Cayman Islands Police as a detective superintendent, head of crime. My life has been extremely good. I had a significant trauma 6 years ago. Whilst working, I was subjected to a vicious assault. At the time I was being treated for those injuries, they noticed heart palpitations and AFib.
He had this injury which eventually led to the diagnosis of severe aortic stenosis. As a quick summary, the heart has 4 valves, and the last valve that blood goes through is the aortic valve. And his aortic valve was super tight, meaning that his heart had to pump so much harder to get blood to the rest of the body. Patients with severe aortic stenosis, they're at risk for sudden death.
I'm desperate to return to work, and I've been told within a couple of weeks I'll be able to do that. I've certainly, in the last year or so, seen a real downward trend in my fitness, and I put it down to old age, but apparently it isn't that. It's my heart valve giving away and reducing the blood flow around my body. So I'm hoping the new valve increase blood circulation, more oxygen, and I get my fitness back and can get back to full hard work and hard play.
The incision that we're going to make is right along here, and we'll have a small incision in your groin to put you on the heart-lung machine.
The top part of the chest?
Yeah, the top part of the chest, right along there, okay?
How long?
Probably about this long, like right there, like that, like small. Mr. Lansdowne is otherwise young and healthy. Someone with his risk profile needs a surgical aortic valve replacement. We did a minimally invasive aortic valve replacement where through a small 3-centimeter incision on the top of his chest, we're able to remove the heart valve out, the diseased calcified valve out, and put a brand new valve into place. And the benefit of that is a super fast recovery.
He was absolutely amazing. The information he gave me was absolutely spot on. He said within a week I would be up on my feet and moving around and not a problem.
Hello guys, how are you?
Really good,
Yeah,
really good. It's amazing. 7 days. I can't
Yeah.
believe it. It's phenomenal.
This is a picture of the valve. Most people have 3 leaflets. You had 2, and that's why it was fused there. You see all those little calcium?
Should be smooth.
It should be smooth, but that's actually a risk why patients with aortic stenosis have a risk of stroke.
Within a week, he gave me permission to travel back from Miami, and we flew home here to Cayman. I had a week off at home, and during that week, I felt so good I wanted to come back to work. I forced myself to take that extra week off and then came back, it was probably 2 weeks ago now, and straight back into the fray. And I feel really good.